You're watching the African Nutrition Society podcast. Throughout Saturday, Sunday, preceding the African Nutrition Congress, we've been deliberating on school health and nutrition, practical approaches to improving school health. And I have with me a great man here, Dr. Mawuli Sablah. Dr. Sablah is a seasoned expert in health and nutrition, currently serving as the Regional Technical Advisor for Health and Nutrition at Catholic Relief Services in West Africa. He has consulted for the Bill and Melinda Gates Foundation and served as a nutrition specialist at UNICEF. Dr. Sablah has also worked with FAO, championing nutrition integration into agricultural programs. He holds a doctorate from the Geneva School of Diplomacy and International Relations, focusing on the human right to food and nutrition. His extensive experience spans international development, food systems, and nutrition, impacting underrepresented populations globally. Dr. Sablah, this is so much. You're welcome.
I'm flattered.
As I went through your profile, I'm like, wow, this is a great man. And I'm telling you, your pocket is where I'm going to be from today.
Yeah.
How has the pre-conference been? Your impression?
I mean, and thank you for having me on this platform. And on behalf of our president, the president of Catholic Relief Services, Sean Callahan, and also on behalf of my own regional director, Mrs. Jennifer Overton, who was also present at this pre-conference. Right. We would like to really thank you for this opportunity to showcase what we have been doing in the area of school health and nutrition in Africa. We are one of the Catholic Relief Services is the leading implementer when it comes to U.S. Department of Agriculture funded initiatives on school health and nutrition in Africa. We are in 10 countries, 7 of which are here in West Africa. And then 3 others, including Lesotho, Madagascar, and Burundi. And in West Africa, we have school health and nutrition programs in Benin, in Burkina Faso, in Mali, in Sierra Leone, in the Gambia, in Guinea-Bissau, in Togo. So we cover significant grounds, providing school meals to over 1 million children. School meals? Yes. Wow. Nutritious school meals. I must precise that. Nutritious school meals. Fortified with essential micronutrients. I like that you emphasize, please let me interrupt. I like that you emphasize nutritious school meals. Yes. Is it that you have packaged the meals or you have people on the ground who serve the children? How do you ensure that these meals, as you have designed to be of high quality, on the ground is as is on paper? So we receive commodities. That are fortified with essential micronutrients. Great. And also under our local regional procurement, we procure locally available, nutritious, nutrient-dense foods, high in essential micronutrients. So we make sure that the food commodities that we use and the locally procured foods, including vegetables, including locally available vegetables, and, for example, also roots like orange flesh sweet potato. We want to make sure that we have essential micronutrient-dense foods for our school feeding programs. Of course, the meals are prepared locally by volunteers in the schools, and there is always supervision. Also, we have school management committees, and those who prepare the food, the caterers, are also trained on how to cook the food and how to provide and feed the children in such a way that we meet their at least 30% of their energy needs, but also providing essential micronutrients. And in addition to that, we also do supplementation with essential micronutrients like vitamin A in some schools. That sounds really good. Yes, and we also do deworming because it is important. We don't want children consuming nutritious foods and then some helminth or some worms is taking the better part of the meal. Right. So we deworm them also. And then we provide nutrition education and also school gardens. And our school gardens are not to necessarily complement the school meals, but sometimes some schools do that. It's mainly to provide nutrition knowledge and nutrition education so that children right from childhood are able to understand the importance of nutrition, how to produce nutritious foods, and how to consume them. Because we know that children also, as they grow, they develop food habits. And those habits live with them all through their lives. And we want to make sure that they have healthy food habits by consuming, promoting the consumption of fruit and vegetables.
Yeah, that
and
reminds
also
me.
nutritious foods.
Right.
Yes.
I'm really impressed with what you're doing. And with the school gardens, it reminds me while in school, at grade class, we were taught how to cultivate tomatoes, pepper in our backyard, even in boxes.
Exactly.
So I think while children are doing that in school, when they go home, they get their parents to help them cultivate these. And once we were harvesting the pepper and the tomatoes, it was really nice. So I think it's good that you're doing that.
And we also want to make sure that the children don't spend too much energy doing that.
Okay.
So in some communities, we have even the Parent Teachers Association and the community themselves having some community gardens to actually complement the school meals. But the main objective is really to provide nutrition knowledge.
Yes, nutrition knowledge.
Yes, around school gardens. Yes.
Wow. You've said a lot, but I see that you've worked with major organizations like the FAO, UNICEF, the Bill and Melinda Gates Foundation. How have these experiences shaped your approach to addressing school health and nutrition?
Okay, so yes, and I must say that I think I've been very privileged professionally to have worked with various organizations, from Helen Keller International to the Food and Agriculture Organization to UNICEF, and now with Catholic Relief Services, and also the Gates Foundation that I consulted for before joining CRS. And to answer your question on how these different institutions have shaped my professional development, I think that it actually given me a very broad overview of understanding of the integrated nature of nutrition and how to make sure that the engagement with multi-sectoral stakeholders and platforms understand the importance of how they contribute to improving nutrition outcomes.
Right.
And so starting out with Helen Keller International, managing their large-scale food fortification program, I worked on ensuring that we bring public and private sector together through public-private partnership initiatives for large-scale food fortification across the Africa region. And so that has, with a very high burden of vitamin and mineral deficiencies in our region, especially in anemia, where more than 1 out of 2 women of reproductive age have anemia, and in some countries as much as 80% of pregnant women have anemia. Also, due to the, linked with iron deficiency, and of course, the high burden of vitamin A deficiency, zinc deficiency, and iodine deficiency. And of course, iodine we have tried to address through universal salt iodization. Okay. So for West Africa, for example, Assembly of Health Ministers have passed a law for mandatory fortification of vegetable oil with vitamin A and wheat flour with folate and iron. And so working with all 15 countries, strong partnership with the West Africa Health Organization and also with the Economic Community of West African States, ECOWAS, we've been able to get all the 15 countries to pass mandatory legislation on fortification.
Is Ghana included?
And Ghana is included. And Ghana and Nigeria is one of those countries that passed the mandatory policy long ago on fortification. And currently, CRS, Catholic Relief Services, building off from some of the work that we've done with Helen Keller International, is also kind of really actively involved in scaling this up, in reviving national alliances for food fortification across all West African countries, all 15 countries, reinforcing capacity of regulatory institutions to enforce compliance to the standards on fortification, but also making sure that the laboratories have the capacity to test the levels of micronutrients, and ensure the high coverage of iodized salt, vitamin A fortified vegetable oil, or wheat flour fortified with iron and folate. And so, currently with funding from the Bill and Melinda Gates Foundation and also the German government, and in consortium with GIZ, Catholic Relief Services is now one of the leading implementers of large-scale food fortification in West Africa. And we have an MOU with the West Africa Health Organization, looking at health more broadly in an integrated way, working in malaria, working in strengthening health systems, and also nutrition. And the different institutions that I've worked with has allowed me to really bring in a broader perspective in partnership engagement, and maybe also my training in diplomacy and international relations in making sure that the public and the private sector work for ensuring impact of our nutrition programming on the most vulnerable population.
You've been an advocate for integrating nutrition into agric programs. So how can agric programs, agricultural policies be better aligned with school nutrition initiatives? And also, you mentioned undernutrition. We're also struggling with overnutrition
and the whole food environment and its impact on that.
Yes, I know initially our concern was undernutrition. So how do you think the global rise in non-communicable diseases impacts school nutrition policies? I know this is a lot, but...
Yes, where do I start? Maybe let me start off
the integration of
nutrition into agriculture and making sure nutrition is embedded in agricultural policies and programs and strategies and investment plans. And this is one of the focus area when I was with FAO. And we established the Pan-African Parliamentary Alliance for Food and Nutrition Security when I was with FAO. And with Catholic Relief Services, we have close engagement with countries working with agricultural programming on the ground. And we want to put a particular focus on the nutrition sensitivity of our agricultural interventions.
Great.
So we want to be promoting nutrient-dense foods, biofortified, nutrient-dense food varieties for cropping. We also want mixed farming systems so that we can combine, livestock, especially short cycle livestock, keeping poultry to have eggs and meat, keeping ruminants to have eggs, to have milk, but also with meat and dairy products, and really diversify that and use the waste byproduct of the livestock to make sure that the crops have the nutrients and the manure to be able to do well. So have that integration in a very coherent way of livestock and also nutrient-dense food varieties, but address the key nutrition indicators as a way of tracking and monitoring our agricultural programs, and then reinforce capacity. We also want to mainstream nutrition education into the curriculums of agricultural extension officers, as well as community health workers. And these stakeholders and partners are in direct contact with the farmers, with the health facilities, so they have greater understanding of nutrition and its importance of integration. In some communities where we work, we have community-led total nutrition programs, CFTN, and community-led total sanitation programs to really get the communities to understand the importance of integrating these programs to impact on nutrition outcomes. And then they have community scorecards where they actually track the progress they are making in terms of some of the key parameters when it comes to addressing malnutrition in a very integrated way. But when it comes to the policy level, it's also to get the government to understand that we need to mainstream nutrition into national agricultural and food security investment plans. So we are not just focusing on producing cash crops, so that farmers are producing cash crops and they are not able to meet their food and nutrition security needs. So we want to make sure that there's a lot of focus on food-based dietary guidelines, so a lot of education on the importance of producing and benefiting and consuming nutrient-dense foods, some cash assistance and support. So we have community savings and loan schemes to help vulnerable women groups to be able to access funding to support their agricultural activities and also access nutrient-dense foods. And livestock, like I said, combining mixed farming systems of cropping and also livestock. But we want to understand that these are included in the policies, the investment plans, and the frameworks that is at central level, and government provides increasing resources for implementing this.
Okay. I think the second part of the question remains unresolved about the global rise in non-communicable diseases impacting school nutrition policies.
Yes. So when you take the food environment, so we have the external food environment and we have the personal food environment. And so at the level of the external food environment is really what, for example, industries are or food retailers are serving schools within school environment. And more we are seeing that ultra-processed foods, and people don't have time and convenience. As a result of convenience and lack of time, people are consuming ultra-processed food, very high in saturated fats, high in salt and sugars. And this is therefore leading to the nutrition transition that we are also seeing in a number of countries where we have what we call the double burden or the triple burden. And so we are witnessing the increasing rise in overweight, obesity, and NCDs. And it's linked to the external food environment, but also because of lack of knowledge, and it becoming a status thing for people to be consuming fizzy drinks and eating from fast food joints and highly saturated ultra-processed foods, which is really complicating things. So now we are having challenges with hypertension, diabetes, and cancers, and huge socioeconomic cost of that, because when the populations are supposed to be productive, when the people are 35, 40, 50 years, that is when they are being confronted with some of these challenges also. Of course, we have them also in children, but then you also have to spend a lot of money on healthcare, managing these conditions. So it's better for us to prevent it with access to healthier diets. So we are encouraging people to eat more fruit and vegetables.
But that's education, but policy-wise, do we have a balance?
So as we educate people, we have to also make investment in the production and also the accessibility and utilization of the healthy diets. So making sure it's available, it's accessible, and it's utilized appropriately.
Okay, so I think in some previous interviews we talked about taxing
unhealthy
tax on unhealthy foods.
Yes. Some governments I think some governments depending on labeling practices and some of that they try to also tax unhealthy food to discourage consumption of unhealthy foods. But I must say that it's important for us to understand that education is important, but also we need to get the private sector to also do the right thing. And that is why it's important for us to engage the private sector at the table. Sometimes we take certain conventions and decrees and text by government without involving the private sector. And we need to be more open to engaging with the private sector, getting them to understand what they are doing right, but also what they are doing wrong. They can be making profit while serving good and investing in corporate social responsibility and reformulating food to make them more healthier, reducing higher salt intake and improving intake of more healthier choices like fruit and vegetables and less ultra-processed foods, and making sure that our population are in better health. And also address the challenge of sedentary lifestyle, and making more people active, so we can reduce the burden of non-communicable diseases.
Great submissions. But as part of your final words, because at the end of the day, for most of these challenges, particularly the marketing of unhealthy foods, because they are let into our countries, into our supermarkets. So what policies or programs would you recommend to promote sustainable and nutritious school feeding programs, for example, in developing regions across Africa?
So I think we need to work, policies have to be integrated and also need to make sure that we commit to make the investment necessary. It's been demonstrated that if you invest maybe 25 million in school feeding, you'll get in hundreds of thousands of millions in terms of socioeconomic return, which makes business sense in preventing and investing in human capital development. So our policies for school health and nutrition should be integrated. We need to make sure that it's a human right for all children to receive the services, the product, and have the understanding to practice a healthy nutrition. And also make sure that we work with partners in a very coordinated way. So policies must ensure coordination of the effort that partners bring on board. And also ensure that governments reinforce capacity at local level, and engage local communities to take ownership of school health and nutrition programs in a very sustainable way, make them homegrown, and invest in the market systems that ensures access to healthy diets to be part of school meal programming. And some of the other key issues is to make legislations and laws for school feeding programs.
Nice.
I think there are many, but yes, these are a few that I can cite on how to respond to this. And Catholic Relief Services in the countries where we are working, we want to make sure that government understand the importance of their role. And I think in Africa, a lot of government invest a lot in school, but it's still not sufficient. For example, in Ghana, investing 1 CD 20 pesos per child. We know the inflation rate.
And egg is even more than one, like 2 CDs.
So you can imagine the quality, the challenges that we are faced with. And this is the country where we've been successful in transitioning school feeding to government, and government is fully managing it. But we have quality challenges, and we want to make sure that government understands that healthy meal is critical, and so they must put in the more money to make it work.
More investment. We have to see the relevance for now and the future.
Yeah.
It's been great having you, Dr. Mawuli. A lot of learnings here. Many thanks for the great work that you and your team at CRS have been doing. We hope to see more of that, especially in Ghana. And I am for practicality, like the groundwork.
Yes,
it's not
and that is what we are doing.
To sit in the conference and in our offices and implement and give the money out. But I think that we should have people on the ground
and
make sure that what is on the paper, what we say is quality, is what our children are really having for their
And as we get learnings from the ground, we need to make sure that we scale that up and also influence the policies and investments that government is making towards these initiatives. And that is where it's quite interesting being with Catholic Relief Services. In over 110 countries, we are doing very practical programming in health and nutrition, malaria, nutrition, health system strengthening, capacitating the system, and leveraging those learning to influence policies in a very intentional way.
Excellent work, really impressive. Well, viewers, if you have any comments, kindly put them in our chats. This has been the ANS, African Nutrition Society podcast. We've been discussing school health and nutrition. And many thanks to our sponsors, especially the Catholic Relief Services, for helping us put this together. We are very grateful. Thank you. And there are other sponsors as well. You see them on our screens. So see you another time.